In this presentation, we will discuss how hot environmental conditions affect athletes. Our objectives for this presentation are to describe different types of heat-related illnesses and their unique signs and symptoms. We will outline different populations most at risk for heat-related illnesses and discuss strategies for preventing heat illness. We will review current guidelines in management and treatment of heat-related illness, and finally discuss specific considerations for athletic trainers. The four main types of heat illness in order of severity are exercise-associated muscle cramps, heat syncope, heat exhaustion, and heat stroke. Exercise-associated muscle cramps may occur in any temperature environment and are not associated with an increase in core body temperature. The hallmark of exercise-associated muscle cramps is a progressive and involuntary painful cramping of skeletal muscles. Athletes may also experience profuse and prolonged sweating with the cramping. Unfortunately, the cause of exercise-induced muscle cramps is not fully understood, but has been hypothesized to be attributed to dehydration, electrolyte imbalance, primarily sodium depletion, altered neuromuscular control, and general fatigue. Heat syncope is also referred to as orthostatic dizziness. The hallmark of heat syncope is an episode of lightheadedness that may or may not involve fainting, caused by pooling of blood in the lower extremities and relative cerebral ischemia. Heat syncope is typically associated with poor heat acclimatization, but may also occur in those properly acclimated. Heat exhaustion is characterized by an inability to exercise in the heat, heavy sweating, fatigue, malaise, loss of appetite, vomiting, headache, hyperventilation, tachycardia, and hypotension. Athletes suffering from heat exhaustion will have a core body temperature below 105 degrees Fahrenheit. A core body temperature above 105 is a classic marker for heat stroke when accompanied by other symptoms. Heat exhaustion typically occurs in hot, humid environments. Some organizations will classify those suffering from heat exhaustion into two categories, being water depleted or sodium depleted, and classify each clinically by onset and progression of symptoms. Of note, the sodium depleted variation of heat exhaustion is considered hyponatremia, which in endurance athletes deserves special consideration when planning nutrition for these athletes. Hyponatremia is not necessarily associated with heat exposure and therefore will not be covered in details in this presentation. Exertional heat stroke, in contrast to heat exhaustion, is characterized by a core body temperature over 105 degrees Fahrenheit. Exertional heat stroke is the most severe form of heat illness and is considered a life-threatening condition. Core temperatures over 105 can result in end organ damage, including renal insufficiency, rhabdomyolysis, liver injury, and damage to the central nervous system. The extent of the damage is determined by the magnitude and duration of the temperature elevation, meaning that the higher the temperature and the longer the temperature is above 105, the greater likelihood of damage. Similar to heat exhaustion, heat stroke typically occurs in hot and humid environments. The first signs of heat stroke are central nervous system dysfunction, including collapse, aggressiveness, irritability, confusion, seizures, and altered consciousness. According to the American Physical Therapy Association Sports Physical Therapy section, heat stroke carries a 10% mortality rate that increases with the duration of symptoms and should be considered a medical emergency and activate the emergency action plan at a given facility. Recognition of each type of heat illness is essential to the athletic trainer, who will likely be one of the first to notice changes in an athlete's status. As described previously, the hallmark of exercise-associated muscle cramps are acute, painful, and progressive muscle contractions with normal body temperature. Heat syncope is dizziness, often accompanied by fainting and loss of consciousness without an elevation in core body temperature. Heat exhaustion is characterized by complaints of fatigue, confusion, irritability, thirst, loss of breath, headache, and an inability to continue exercise, but with a core body temperature below 105 degrees Fahrenheit. The hallmark of heat stroke is a core body temperature above 105 degrees Fahrenheit. and is characterized by more severe central nervous system symptoms, including but not limited to collapse, seizures, hyperventilation, and shock. Risk factors for heat illness can be categorized into both internal and external. Externally, hot and humid environments with little airflow pose an increased threat for heat illness. Clothing such as padding in football, men's lacrosse, or hockey, or military uniforms or equipment also increases risk of heat illness. Internally, those with a higher BMI and those with poor overall physical conditioning are more at risk. The very old and the very young are also more at risk due to potentially compromised tolerance for heat or compromised heat loss mechanisms. Nutritionally, proper hydration is essential for preventing heat illness and must be a focus before, during, and after exercise in order to decrease risk for heat illness. Females also tend to be more at risk for heat illness, and it is hypothesized that the female body runs at a higher base core temperature during the luteal phase from increased progesterone in the body. Prevention of heat illness has most to do with minimizing the risk factors previously mentioned. Making sure athletes are properly hydrated and clothed in loose, light-colored clothing will help decrease the likelihood of heat-related illness. Educating athletes, parents, coaches, and administration on the signs and risks of heat illness is also important in order to raise awareness of the severity and possibility of heat illness. Hot and humid conditions cannot be changed, and therefore if the weather is too severe, it may warrant modification to the activity. This may mean canceling practices or rescheduling games. Finally, a well-orchestrated acclimatization period for athletes who may be at risk for heat illness, either due to the nature of their sport, their personal characteristics, or the weather conditions, may also help decrease the likelihood of experiencing heat illness. Preseason heat acclimatization may be one of the more effective ways to prevent heat illness on a large scale. The acclimatization process may even serve to help improve individual or team performance, which may be helpful in gaining buy-in from coaches or players. All athletes participating in warm or hot environments should participate in acclimatization. Outdoor as well as indoor sports should be considered. Indoor sports such as wrestling or swimming may benefit from acclimatization due to the warm, humid practice and competition facilities. Key components of the acclimatization process are a preseason physical, the 14-day progression, and the differentiation between a practice, walkthrough, and a recovery period. As an athletic trainer, it is important to be aware of exactly what is required for a preseason physical in your state, at your school or institution. You must make sure all relevant information is communicated and important information is not left out. Some physicals may not be appropriately in-depth and may require added forms in order to acquire the necessary information. Preseason acclimatization period will take a minimum of 14 days to complete, not including rest days, days sat out by an athlete, or days practice could not occur due to weather or other cancellations. A practice is defined as a period of time a participant engages in a coach-supervised, school-approved, sport or conditioning-related physical activity. The maximum time for a practice during acclimatization is 3 hours, which includes warm-up, stretching, and cool-down activities. Weight room and conditioning activities are also included as practices. A walkthrough is considered a teaching opportunity without protective equipment or any sport-related equipment. A walkthrough during preseason conditioning may last as long as 1 hour. The recovery period is defined as the time between the end of one practice or walkthrough and the beginning of the next. Recovery periods should take place in a cool environment without any sport or conditioning related drills. The basic rules of acclimatization period include the 14-day minimum, 1 day of rest following 6 consecutive days of practice, and that those who miss a day of practice must still complete the full acclimatization period and should not be allowed to rejoin team activities until they have done so. It is also important to note that if an athlete undergoes the full acclimatization period and is fully participating, but sustains an injury requiring extended time off, that the athlete may need to reacclimate prior to fully rejoining the team activities after the injury. The 14-day acclimatization period is broken into two phases, starting with days 1 through 5. During days 1 through 5, there is allowed at most 1 practice per day and 1 walkthrough per day, with a minimum of a 3-hour recovery period between practices and walkthroughs. Below is an example of what might be scheduled for a football acclimatization period. It is important to note that sports involving padded equipment like football, lacrosse, field hockey goalies also have equipment restrictions during the first days. On day 6, full contact and full pads may be started. Also note that weight room training is included in the single 3-hour block allotted for practice during this period. During days 6 through 14, there is a limit of 2 practices per day of no more than 3 hours each, again including all warm-up, stretching, and cool-down activities. Total practice time for the day may not exceed 5 hours, meaning that if one practice is 3 hours, the other practice may only be 2 hours long. Double practice days must be followed by single practice days or complete rest days. Walkthroughs may still occur in this time, but may only occur once on single practice days for 1 hour max. In this example, day 6, Saturday, is the 6th consecutive day of practice, meaning the following day, 7, will occur Monday after a complete rest day on Sunday. This also means that with Saturday being a double, followed by complete rest, Monday may also be a double and Tuesday a single. This pattern continues until day 14 when the acclimatization period is complete. Preventing heat illness through proper hydration is also essential. Individual fluid loss depends on a variety of factors that will differ for each athlete. When sweat loss is greater than fluid intake, this results in a net loss of fluid from the body and subsequent dehydration, which can lead to heat-related illnesses. Hydration can be measured in a variety of ways with a range of different equipment, but the easiest and most convenient measurement is by urine color, as shown in the previous slide. Body weight change may also be an effective measurement of hydration. A 1 to 2% change in body weight during physical activity may result in physiologic compromise and decreased performance. A greater than 3% loss of body weight increases the risk for heat illness. It is not uncommon for some football programs to require athletes to weigh in and weigh out of practice each day when they enter or exit the locker room for practice or games. Although body weight may indicate dehydration, it may also be an indicator of hyperhydration and hyponatremia, especially in endurance athletes such as marathon runners who must carefully ingest sodium and water in balance throughout competition in order to maintain euhydration status. In order to maintain euhydration, it is first recommended to be properly hydrated before practice. On 2-a-days, this becomes increasingly important prior to the second practice of the day during the recovery period. During exercise, some institutions recommend to drink beyond thirst, and others recommend to drink to thirst. As a general rule, if you think you need water, take a sip or two to avoid severe thirst and to maintain hydration. During exercise, it may be wise to add salt to the fluids in order to avoid hyponatremia. Gatorade Endurance Formula, for example, has a higher sodium content than normal Gatorade in order to accommodate the sodium needs of athletes. After exercise, it is important to replenish water lost during exercise that was not able to be replenished during exercise, as well as carbohydrates and electrolytes. It is generally not enough just to ingest water alone when trying to maintain hydration status. When considering hydration, it is important to note that everyone's sweat rate is different. Sweat rate may be calculated with a simple formula and may be useful for endurance athletes. However, sweat rate will change with acclimatization status and environmental conditions and may be difficult to calculate and track on a large scale. If the weather is too severe, it may warrant activity modification in order to prevent heat illness. This chart is based on wet bulb globe thermometer readings Note that at 92.1 degrees Fahrenheit or 33.4 Celsius, no outdoor activities should be allowed. Below that, modifications should be made until the temperature is at or below 82 degrees Fahrenheit or 27 degrees Celsius. Using this chart, we can calculate the wet bulb globe thermometer temperature and therefore determine if the activity requires modification. For example, if it is 60% humidity and 33 degrees Celsius or 91 degrees Fahrenheit, that would result in a wet bulb globe thermometer temperature of 35 and would warrant canceling outdoor activities. However, at that same temperature of 33 degrees Celsius, 91 degrees Fahrenheit, in 5% humidity, would result in a wet bulb globe thermometer temperature of 24, and there would be no need for activity modifications. After identifying an athlete as having a heat-related illness, it is essential to be familiar with how to manage the condition. Exercise-induced muscle cramps are usually effectively managed with oral sodium and water, but may require IV fluid replacement if dehydration or hyponatremia is severe. Rest and passive stretching and massage may also help. An athlete with heat syncope should be laid down in a cool place with their legs elevated in order to draw blood back to the cerebrum and out of the legs. The athletic trainer should monitor vital signs in order to monitor possible progression of the condition. Efforts for fluid and sodium replacement should also be made. Athletes experiencing heat exhaustion should immediately discontinue activity and rest in a cool place and make effort to replenish fluid and electrolytes. Caution should be taken with these athletes as their condition may progress to heat stroke if not effectively managed. Efforts should be made to keep the body cool and prevent venous pooling of blood in the legs. Heat stroke is a medical emergency. However, athletes experiencing heat stroke should be immediately cooled on site rather than be transported to the hospital for cooling. The longer the athlete's temperature remains elevated, the greater the risk for end organ damage. Therefore, waiting for EMS or the hospital to begin cooling may be the difference between life and death for an athlete. Cooling should ideally take place via cold water immersion. A common method for accomplishing this is by immersing the athlete in a tub of water, pre-filled in order to avoid lag time, and adding ice in order to bring the water temperature down and cool the body. Alternatively, if immersion is unavailable, ice should be applied to the axilla, groin, and neck, and efforts to increase airflow over the skin should be made. The speed of the cooling process is essential for survival. Once the core temperature is stable and below 38.8 Celsius or 101.8 Fahrenheit, the athlete should be transported for advanced medical attention. Athletic trainers should be aware of what their athletes are doing not only during physical activity but before and after as well, because those behaviors may directly affect what happens on the field. It is important to note that there are wide variations in heat tolerances among athletes, and while distinct temperature cutoffs were presented here and are supported in the research on this topic, athletes with temperatures as high as 41.9 degrees Celsius or 107.4 degrees Fahrenheit have been recorded and reported and shown no symptoms of heat illness. However, as a general rule, it is better to be safe than sorry when considering heat illness, and if at all suspicious, an athlete should be treated as if experiencing heat illness. The athletic trainer should also be aware of the cumulative effects of heat exposure, not only at practice but at home as well. For example, a college football player who practices during the day in a hot environment and goes home to an unair-conditioned apartment to sleep at night will be exposed to more cumulative heat and be more at risk for heat illness than a teammate who goes home to a well air-conditioned and ventilated apartment to sleep. Education on heat illness is essential to preventing tragedy. Education for coaches and athletes on the importance of acclimatization and establishing good rapport with coaches and players. Education to parents on what to watch for in their children and how to best accommodate them at home before and after practices. Education for coaches and athletes and administration on early warning signs of heat illness, and education for teachers about pre-exercise nutrition needs, as many high school athletes may not be allowed to eat or drink in school immediately prior to exercising in hot conditions. Thank you for your attention during this presentation. For more information on heat illness, the National Athletic Training Association, as well as the American Physical Therapy Association and the American College of Sports Medicine, all have position statements or papers related to this topic, as well as hydration, hyponatremia, and other related topics mentioned during this presentation.